Welcome, everyone. Welcome to USF Uninorte, a global public health clinical experience. We're so happy to have you join us. I am Dr. Ivonne Hernandez, and I serve as a Chief Officer of DEI for our College of Nursing here at University of South Florida. I am also faculty as an assistant professor, and I've had the privilege and ability to participate as clinical faculty taking students for this global public health clinical experience in Barranquilla. I want to introduce my colleague, Professora Stefany Ortega. Do you want to share, Judith?
Hi, everybody. It's a really pleasure to be here today. I'm Stefany Ortega-Perez. I'm assistant professor of the nursing department, and also I'm the coordinator of the simulation lab of Universidad del Norte. So it was a really pleasure for me to be part of this experience that when you come here to Colombia, to Barranquilla. So uh, go ahead.
Thank you. And I also want to introduce Stefany Mago, who is here as our USF student who participated in our global public health clinical experience. You want to say hello?
Hello, my name is Stephanie Mago. I'm a level 4 student, part of the St. Pete campus for the Accelerated Second Degree program. And I'm super excited to be here and tell you about this wonderful trip.
Wonderful. So just very quickly overall, what are some of the implications for practice of this global public health clinical? So there are many, right? But in particular, increasing the sensitivity to cultures that are different than ours, increasing global health awareness, and really preparing individuals, especially those in particular for us when we're focused on nursing, the profession of nursing, the future nursing workforce, to be advocates for change in healthcare. Also, we had an opportunity to identify common health issues, look at them, assess them, and then learn about and provide some insight regarding the regional context. So not only the differences in the healthcare system, but the groups that are represented, the variation in rates of different diagnoses, and really start to appreciate the differences in cultures and populations. And so we're very excited that this is going to help our students, one component of many, right, that we do here at the college to help them prepare and be more focused, not only to address healthcare issues here locally, but also globally. So this previous October 21st to 31st, it was 10 days. We had 7 students with us. You can see them here. That's actually when we arrived at the airport. They just got off the plane. And I served as the Global Public Health Clinical Faculty Lead. And we're very excited. We arrived and started our trip and our immersion. So started to just show a little bit about Universidad del Norte. And if Professora Stefany wants to talk a little bit about some of these images and sharing us a little bit about what we see.
Yeah, I think that we have a campus that provide all the students a different size to move it. We have the traditional classroom, but also combined with nature, typical animals like the iguanas and a lot of cats we have here. And also we have a, a merchandise, like a brand that is Norte, that is all the restaurants. And for I don't know if you know that all the money that Norte earn is for a new scholarship.
No.
So yeah, it's really important to know that you notice that it's not do notice not only restaurants also have the the store for buying things, and also have a drugstore, and all the graphic that for if you can print, and students that study, for example, architecture or design, can doing all the prints for their project. So it's all the money that do not earn is for a new scholarship for new students, and this is very important to us to
Yeah.
promote all restaurants and all activities that do not do it. So this is Boca de Cenizas, the last restaurant that was open, because have a really nice view to the Magdalena River, and and I think that our campus really give the students the opportunity to have a different experience inside.
Thank you. So overall, it's an incredible concept to have that for the income that comes from Norte to go right back into scholarships and opportunities. Universidad Norte is a private university in Barranquilla, Colombia, so that's an incredible way to continue to give back. Oh, and then here we have basically just a bit of a potpourri of different pictures. That was our first day with the Colombian flag behind us, or the colors. We went for our first day into Uninorte and then the start of our clinical experience. That first day and throughout that week, we had lectures. So we had lectures that provided us some concept of the differences and similarities between the education for nurses as well as doctors and other healthcare professionals, to help inform us. We also learned about the healthcare system in Colombia, and we're able to work in groups and compare contrast. We also had information and learned about some of the tropical diseases such as dengue and how to prevent that. And also started to learn more about the indigenous groups in Barranquilla, Colombia, and the research and the work that's being done at Uninorte. And I don't know if Stefany, if you want to say anything to add.
Okay, well, about that research that I'm doing with the communities that are from the north coast of Colombia, especially in the Sierra Nevada, but it's near 2 hours from Barranquilla. I think it's really important that university not only stay here in Barranquilla. It's important that we move and go with other communities that are important to us for our culture.
Thank you. Then I do want to share here that Uninorte in their curriculum nursing has 5 semesters of English, so that for our students who are traveling, we basically required at least level 1 of the Canopy Medical Spanish course. And this is a resource that we have under USF Health for our students, which is a great start to improve the communication, but in particular for our students who are traveling, having this beforehand and prepping, and perhaps this helps to bring back maybe any foreign language they might have had in high school or back then, to prepare them to be able to have a better experience. We had support for communication, not only by bilingual faculty, but also students and global peers that supported. But it is an opportunity to come out from this experience a little more ready to help and support your Spanish-speaking patients and community here in Florida or wherever you may go once you've graduated. We also had some medical Spanish courses or 2 classes during that week in that session. So I don't know if Stefany, our student, wants to share anything about that in particular.
So I would just say, I am a Spanish speaker, so it was really good to see the benefit of learning the medical Spanish, even though I did have a foundation of it. But for all the non-Spanish speakers that were on the trip, I think they learned a lot and were able to carry it through. Like, I know one of the fellow students that went on the trip, Christina, she used the Spanish right when she got back, and we both work at Moffitt together, so I know she used it at Moffitt. So it was cool to see that she did take something from it. Yeah.
Thank you. So now we're going to start to use some of these images to kind of walk you through the 10 days that we were there. One of the areas that after we had our welcome, we had an initial meeting, some lecture in the morning, and then we went to Puerto Colombia and in Barranquilla, Colombia, and we were able to take a tour of this port that is being built out. That is something historically, but now is being developed further. And so we were able to visit, to walk around and really start to learn a little bit about the historical importance of Puerto Colombia and the influences to Barranquilla, Colombia, from all the different nationalities, countries, and origins that came through to Barranquilla, Colombia, through Puerto Colombia. And some of the pictures you can see, there's images as this man right here, and there is and through different areas of Puerto Colombia, and those reflect the different groups that came through to Barranquilla, Colombia, which is one of the bases of the diversity within Barranquilla, Colombia. Professora Stefany, you can add, anybody wants to add?
Yes, that's all true that you talk about the importance of Puerto Colombia in the develop of Barranquilla and the develop of Colombia. That's why Barranquilla is called the gold door, la puerta de oro de Colombia, because we have a lot of influence of other cultures that made that we have really move on the entire country, not only Barranquilla, because for this port introduce a lot of music, culture, technology that we needed in that moment. So this is really important to know that that Puerto Colombia is a really important part of the Colombian coast, and maybe now needed to that we can do it a little for effort to now that Puerto Colombia move on.
Mm-hmm. Yeah, so what you can't really see in these images, but there's a lot of construction happening to build this. So we know the historical, and there hasn't. Then I think there's an opportunity to now grow and build. So it'll be interesting the next couple of years to see how this comes out. In addition, we continued in Puerto Colombia, and we're able to have a stop at Hotel Prado Mar, in which we were able to, take a dip in some of the ocean, but also to start to come to the culture, the music, the food. And so, Stefany, if you want to add anything here, we see you here.
Yeah, so when we were over here, we were able to, yeah, go into the ocean, so that was fun. Got to see everybody got to eat like a traditional plate of food. Sadly, I'm allergic to fish, so I couldn't have it, but everybody else did. It was great. You could see it there. That was like a very traditional plate of Colombia. And then we also got to do a dance lesson, which was really fun and really got to immerse us in the culture. And just we got to learn some like famous and traditional dances that they do in Colombia.
Mhm. Thank you. On the next day, in the morning, we were able to visit Hospital Nazaret. And Hospital Nazaret is a level 2 hospital, a level 2 hospital. So in Colombia, there's level 1, 2, and 3. And level 3 is the highest acuity. And level 1 is the lowest. So this is in between level 2, where it's a one-stop shop where individuals from the community can come really seek care, from internal medicine to pediatrics to prenatal care, immunizations, growth and development. There's the dentist there. It's really comprehensive. And they also have sort of like an urgent care approach, like a little ER there. Again, that's critical to serve the community. And so we were able to participate and go through for the day and rotate our students through the different experiences where students were able to go in and observe for the internal medicine, work with vaccinations. They were getting vaccinations. I think it was for yellow fever. Correct. Yes, it was traveling. We were able to work with growth and development and really just get a feel for the population coming through and understand the flow and the care that's provided. And I know, Stefany, you were in, if you want to share, which rotation did you go through?
I was in cardiovascular risk and also in prenatal. So I think that this kind of hospital are really important for us to have all that we talk about the prevention. This is the hospital that control all of that. That we have all the programs of the first level of attention, cardiovascular risk, prenatal vaccinations, what and others that and general consultations that the personal need, and also is important to highlight that this is for people who have a public health that are part of the public system health.
Mhm.
So
Yeah.
yeah,
Colombia predominantly, I think it's 97% of the population has access to insurance. And so it's either the subsidized or the unsubsidized. And it's not as simple as that. It's complicated, just like our version is also complicated. And so the importance of and the focus on primary prevention and risk reduction is great. And so that was something that we were able to, and it's a hallmark of the public health clinical. So we're really able to focus in on that, see it happening, participate, but also take that with you as a student rotating through. We were also able to visit a public school, and this is Politécnico. It's actually an all-girls school, public school, and we were able to work with adolescent girls and help support sexual and health reproductive education, which actually we were able to utilize a new kit that was provided by the Ministry of Health. So we're able to support that. We also did height and weight and blood pressure screenings for the adolescent girls, and taught hands-only CPR. And so that was a great experience in being able to start to connect. And anything you want to add about that, Stefany? Because I know that you had the sexual health and reproduction station.
Yeah, so it was really a really cool experience to go to the school and educate the students on all things relating to like the chest confections, but I was doing the sexual health part of it, and just like about like prevention of STIs and the proper way to use like condoms and why you need to use them. And it was very good, interesting to see how much the students wanted to learn, and how the girls really were eager to learn the proper ways to do everything. And it's very different, like culturally, like it's not something here in the United States is a little bit more, people are a little bit more reserved for those topics, but they were asking questions and were really interested for their own health and safety, especially when learning how to prevent STIs. So it was really a really neat experience, and we got to see young girls from like ages like 12 all the way to like 16. So it was really cool.
In addition, these images are of the same school. That day they had a big fair. So we were part of the fair and helping to promote that health education and that focus, but there was a fair happening throughout the entire school. These are some of the images of the school. There was also a music festival happening, and they call it the English Music Festival, in which they learn English by singing English songs. And so you would hear, it was a huge auditorium, and everyone came down to hear and see. And so I was like, wow, this is a great, so it's a technique that they have to teach English within this school to help engage, adolescents and so forth, is helping them learn a song and practice. And so it was a nice little fun added. We were also able to participate.
Ivonne,
Mhm.
Ivonne, Melanie is connected right now, so
Oh,
maybe we can.
sure.
Up,
Of course. Hola, Melanie. Welcome. ¿Me oyes?
Melanie, are you here?
You hear me?
Yes,
Yeah.
we can hear you.
Hello, how are you?
Hi, Melanie. Thank you for joining us. See, Melanie is our Uninorte student, and we're so happy to have you. We are now talking about the Uninorte Health Fair in Pasillo 3.
Oh, excuse me because I was on a meeting, so excuse me about I don't connect it early.
Todo está bien. So Melanie, as we go through the descriptions, please feel free para compartir, and you just unmute yourself.
Okay, well. Okay, I'm so grateful for the experience that I live with the students of the USF, because I practice my English because I don't use too much my English. So I'm grateful for that. I am grateful also because I met a new people, people of other countries, and also the students of nurse. There are ladies that are so beautiful, and they are so pretty. So I'm excited with that.
Thank you. Gracias, Melanie. Thank you, Melanie. So Here at Uninorte, the nursing students do a health fair for the university itself, in which they focus on teaching the peers, the staff, the faculty, and the topics they cover vary to meet the needs. In particular, here you see some images, and there was three areas. One was breast cancer prevention, one was suicide awareness and risk, and the third was about lactation and infant feeding overall. So our students were able to work with Uninorte students to jump in, help, and collaborate and focus on providing some health education to their fellow peers, which was predominantly college age. In addition, we were able to go to a nonprofit, Fundación El Arca. It's located in El Barrio La Esmeralda, which is a low-income, underserved area in Barranquilla, Colombia. And we were able to participate with the Uninorte students. So every event or every clinical that we have, we do in partner with the Uninorte students so that our students are paired and get to meet and work together. So here, this foundation is focused on increasing awareness of mental health. Dr. Romera, and actually she's right here. She's the founder of the nonprofit. And she gave us a tour, explained to us why and how and why it exists, which is basically to help and support families that are suffering with mental health. And Dr. Romero established this from her personal experience and is very devoted to this. And so this is an opportunity to, at this location in this underserved area, what they do is they provide health education to the community, help and support those individuals. This site is utilized as a site for the for psychology and mental health rotation and so we were able to participate, help with the health education, and you see little children because they come with the families. So we were able to help and support so that the families get education. And I don't know, Stefany, if you want to share your experience with the students that you had, Stefany Mago.
Yeah, of course. So while we were here, we got to hear the story of like how this foundation was created. That was really, really cool. And if you get to go on the trip, hopefully you get to hear it as well. It was really inspiring to see why she created the foundation to help other people, like going back with like her story and why she wants to help other people. While I was here, I primarily focused on the pediatric population, so I got to play with the kids. It was so much fun. But in addition to just hanging out with them, playing with them, we got to teach them a little bit about like sun safety, dehydration, hand hygiene. There was a range of ages that we got to take care of. We got to see kids from as little as 1 year old, like 1 year olds, all the way to 12-year-olds. So it was really cool to see the different age groups and how and just like how they interacted with us, and it was a lot of fun. And we also got to interact with the mothers or the sisters or the caregivers that were taking care of the kids, and just it was a really cool experience. And then we also this day got to see some dengue prevention, because that is also one of the research that she does. So we got to go into someone's home. They welcomed us in there, and you could see by the photos like the differences in the living conditions over there. And dengue is a lot of times that mosquito lays, or most all the time, the mosquito lays eggs inside like barrels of like, what's it called, like still water. Like, so if you have like the big jugs with water in there, a lot of times mosquito that's with the dengue will be found in there. So we did get to do like a dengue prevention like search around the house with that professor, and we were actually able to see the eggs of the mosquito in one of the containers, in the top little container right there where they're shining the phone. You see right there a little thing swimming, that or that down there was the larva of the mosquito. So it was crazy to see that just in like this water, there was that larva of the mosquito could be found and could could later flourish into a mosquito and cause dengue. So it was really cool to learn about that.
Yes, thank you, Stephanie. And one of the key things is that while this area has access to water, at one time it didn't, or it wasn't consistent. So the need to store water has been transmitted and continues. You know, it's a belief. I need to have the water, right? Even though I have continuous access. So it's a constant education and reaffirming. And this is something that's being done across all levels and in schools. And I think it may be a generational thing as well, given their experiences, but a necessary. Thank you, Stephanie. In addition, we were able to visit Hospital Universidad del Norte. And so Uninorte has their own hospital, which is pretty incredible. And so at this hospital, this hospital serves to provide the clinical opportunities, but not only at this hospital, in other places as well, for nursing and medicine. They have a dentistry, they have a whole full lab there as well. And so it's an opportunity for those health sciences majors and professions to practice. In addition, there are other schools that are there for the other professions or other domains as well. So this is also Hospital Universidad Norte is located in a very key area. I'm going to ask Professor Stefany to help me the location, but I know that it's located there because it was necessary near a major highway for access.
Yes, the hospital are located in Soledad. That is a town that is next to Barranquilla, and it's important for the location because there's a main street that communicate the Barranquilla with another towns, with another cities. So we have a really move between that Barranquilla and other cities. So 25 years ago that the hospital began to work, there's no another hospital in that site. So that's maybe a lot of people ask why the university, the campus, and the hospital are so apart. That's what the reason, because the reason for university was to think in a place that was needed of a hospital. So was is in the other side of Barranquilla, we have to cross or Barranquilla to move between the campus and the hospital, but was needed in that time. So we have level 3 of attention. We have neurotrauma attention. So we have the ICU, the NICU. So we have a biggest emergency department in the zone. We have 60 beds of observation in the emergency department, and also we have a lot of people that come and go at the same time in the emergency department. So I think that we also that all that zone around the hospital is a low income uh, population, so it's a need to have a level three hospital that they can go. So I think that we are really proud to have the hospital, and the hospital can give a really good attention to that people.
They also have a labor delivery. They have a 10-bed NICU. So it really is a one-stop shop and serving the needs of that community, as Professor Stefany said. Thank you. The one thing I do want to say, so this is a picture of being in the ICUs. The ratio, the nurse to patient ratio is different, very different. I do want to say that in Colombia right now, there is at the national level work being done to address the nursing ratio overall. But right now it's completely different. On the floor, on a med surg floor, is like 20 to 1, 20 patients to 1 nurse, Stefany?
Yes,
But
it's
in the
around
ICU, I think it was 7 to, in the
7 to 1.
ICU, 7 to 1. So it's completely different context, but there's work being done nationally to address that. So that's exciting work. Yeah. We were also able to go to Plaza de Salgar in Barranquilla, again, another lower income, underserved area. You see some images here. This is the backyard of a house. And this is the group here, our USF students and our Uninorte students, doing some debriefing and sharing after going to different homes. We were able to do some assessments. Cardiovascular was the focus, and really honing in on one individual in that family, but also getting information and considering the implications and the impact to the entire family. So really more individualized and focused on the home and the family. I'll let Stefany Mago, if she wants to contribute a little bit about her experience.
Yeah, so this was a really good experience as well. It was really eye-opening. It was very different to see how welcoming the families were for us to go into their homes or sit in the porch with them and just ask them about their medical history and do the cardiovascular risk assessment on them. Like my patient that we saw, she was like she was like 82 or something, and she had such a recollection of all her medications, like what what her illness was, and like just knew all of her past medical history. Like it was so good to see her health literacy. She was very involved with her care, and that was very eye-opening to me. And it was just a complete different experience than here in the United States of what I've gotten to do with like seeing patients, because I've only done inpatient work in over here in the United States and during my clinicals. So getting to do these community assessments was really cool to see that public health in action, seeing all what these Uninorte students have been doing from the beginning of like when they started doing their public health. They've established these relationships with these families, with these patients, that the patients feel so comfortable with them to tell them all their medical history, to tell them what they are feeling, and like if they had any concerns. So it was really cool to see, and I wish we could have done more. Is what I could say. Like I love this experience, and definitely wish we could have done more of it.
I agree with you, Stefany. The Uninorte students and faculty rotate through this community ongoing, so they have well-established relationships. There's also a senior center, and many of the families attend the senior center and the nursing students as well. So different levels that are integrated. And we were also able to visit two family childcare, almost like a VPK, if you want, I think what we would consider here. So children usually between ages of 3 and 5 before they start kindergarten. One was in a home. The other one was a larger area. One had about 13 children. The other one had close to 50. So here we're working with a few of the children, and part of the clinical experience in Uninorte embedded is to do growth and development. So do height and weight chart, as well as assess fine and gross motor skills. And so we're doing some of that right there with the dancing. And we're also very interested in, and this was an idea, I think, I'll let Stefany introduce it, of her group that came through to do a drive.
Yeah. So, and we got to go into these, kind of like VPKs, I would say, or like daycares, where the students were learning, they're still doing like growth and development skills. They were teaching them so many things. But what was one of the things that was very, I don't know, it really hit us hard was the lack of resources that these kids didn't have when they were at these little schools. Maybe more the other one that we went to, the smaller one, compared to this one, but they didn't have crayons, they didn't have paper, they didn't have like little like simple things like everyday supplies. And what our idea is that something that's so easy for us to get, even if it's color pencils you have at your house or like crayons you have in your house. They also do back to school drives where they'll put the crayons for 50 cents on sale. But like if we are able to collect supplies and bring them to these schools, can make such a huge impact in their lives and in their learning, that I feel like it's so simple for us to do that could make a really big impact. So our group thought of an idea of maybe doing a school supply drive for that, particularly targets this population of Barranquilla, Colombia, and these schools that we go to visit. Because in the nursing program, we do multiple drives. We go to Johns Hopkins. We do the ones for like the underserved populations here in the United States or here in just our area of Tampa or St. Pete. But we sometimes don't target internationally. And since we are doing those international trips, I think it's so important for us to make our mark and help out just a little bit that we can do. And hopefully with this drive, it'll make a big impact on them, and they'll be so happy to see the colors and all the supplies that we can bring them. So hopefully we can get that started with the next few generations of USF nursing students. And yeah.
Thank you, Stefany. Yes, we're excited to launch that in the spring semester for our next trip that leaves in March. So we're very excited. So in our trip, we have clinical, we have lectures, and basically it's every day. It's pretty full. I think somebody could say every day is pretty full. Since we're there for 10 days, we really maximize our days. On Saturday, this was our Saturday, like off, if you want to call it, but very not off. We were off to Cartagena, which is about 2 hours, hour and a half, 2 hours away from Barranquilla. So we all got on the bus together and were able to attend. And these are just some of the images of the city tour. We had a tour guide that took us through and understanding and learning about the fort and everything with it. And then we were able to start some exploring on our own as well. And I think I have more pictures on the other side here. If you want to say anything, Stefany Mago.
It was really cool. You could see in the pictures there. We got to see it was like one street that's all dedicated to art, so that was really cool. We go into like when we were in the fort, you could see they kind of call it like the old city versus the new city. So it was cool to see even just the difference in heights of the buildings. It was like more downtown in the new city, like a downtown Miami is what they called it. So that was cool. We also got to go walk around the streets of like their historic, like the town center, I think it was. And we got to we ate there, and we got to walk around those little shops. Something different that we got to see is kind of like the infrastructure, how easily it floods in Cartagena. So it was something different, eye-opening that you can see in Cartagena versus like here in the United States. That even just a gentle sprinkle, or if it rains the day before, how much flooding is left in the water in the streets. So that was different. But Cartagena was really pretty, super cool, and loved it. It was really pretty and very. It was more touristic vibe for sure. Oh, you're muted, Miss
Your
Dr.
mic
Hernandez.
is off.
Yes, thank you. This is just a potpourri of some of the images on the touristy on the move. So after our clinical, or this was actually, so the Ventana del Mundo, right? The window to the world, coming back and really bringing forth the influences that Barranquilla had on Colombia and how many groups came through. This is La Paleta, the name, Stefany. What's this one?
La ventana de campeones.
La
It's like,
Ventana Campeones. Okay, and that is in
a
honor.
tribute of our soccer team, local soccer team that is called Junior.
Yes. Yes. And then on our way back from the hospital, which is in Soledad, this is the statue of Shakira. So the students were able to stop and get a quick pic with the Shakira statue. And so that was a lot of fun. And then some of the food, Barranquilla established in 1813, and this is one of the restaurants within a nice touristy area. And this is Sachipapa.
Papa.
Sachipapa. Something you have to try if you go to Barranquilla. And then we had our farewell dinner where we had the students come as well as the faculty, and everybody was able to join together in the final dinner. This is actually again in a restaurant at Uninorte in 1966, and everyone had a good time there, kind of saying goodbye to the experience. And really, this is in using a few images, a nice quick summary of our trip. Personally, I'd like to say that with each trip and each student group, as the questions vary, and we are continuously always learning. Overall, the emphasis on health promotion and risk reduction is incredible. In Colombia, in particular, from my experiences in Barranquilla as well, and the ability for almost all individuals that live in Barranquilla to be able to access insurance is great. While there are definitely differences and benefits and pros and cons to both groups. And when we talk about our health insurance system to that of Colombia, there's still so much to learn, and there's a great opportunity for us to learn from each other. And so that's kind of what excites me with each of these trips, is that we're able to engage, share, and come up with opportunities to innovate and improve health. And that's the group right there. That was in Puerto Colombia, wearing their global nursing shirts that they designed. Well, I'd like to thank you. I don't know if anyone have any questions. Walter, if you have any questions, thank you for joining us on really this little reflection of the trip.
Yeah, thank you guys. This is a great presentation. I was just curious, maybe Stefany, you would have a good answer for this. I was really struck by what you said about the community being so welcoming to have you guys there. So what do you think we could be doing better in America to be building that relationship? Like what are we missing?
So I would say it's different because there's a lot of things that are already built into our culture as Americans, with like wanting our own privacy and, you know, all these things that are like integrated into our brain from such a young age that I feel like in Colombia they don't they do but they don't in a way. So I think making good relationships with your patients starting from day one, there are many providers that do, but taking the time to truly listen to someone's needs, truly listen to what their chief complaint may be. Like, yes, in an ER setting, we might not be able to do that, but when you go to a clinic or when you go to your local doctor's office, establishing that rapport is something so important that we learn in PCC class. Like, you learn about establishing rapport with your patient. And I think that is something so important that even today, a lot of people are not doing. Like, some nurses just don't have time to do it with the demand. But I think that's an important like foundation that we need to go back to, like creating that rapport with that patient, creating that connection, doing that culturally competent care, and finding what the root, like how to gain their trust is so important that I feel like that's why all the people in Colombia, all the patients that we saw in the community were so welcoming, was that they knew what their root problem was. They knew what their history was. They knew about their family, like what they disclosed. So then that same person felt comfortable. Also, culturally, like Hispanics are very welcoming they're like, oh yeah, you want something? Here's some food. Like, that's like Hispanic culture coming from me being Hispanic too. I know that. But not only that, like these nursing students knew their patients. Like, they were going to them week after week and they knew their patients. So I think that's something that we can start doing here in the United States, is definitely establishing rapport a little bit more. And I know sometimes patients doctor hop and it's harder to establish rapport, but yeah, I think it's really important in that way. And I'm going to be working at Moffitt, so we do see a lot of the same patients, and making an impact on the patient from when you have them is so important that the next time you see them, they're so grateful they're like, oh my goodness, like I remember you were so sweet. So establishing rapport is, I think, the foundation of it. Sorry, it was a long-winded answer.
No,
but
that's great. That's excellent. Thank you very much. That's really good.
you're welcome.
Thank you, Walter. And I'll just add that, giving that same question you asked, even how it's a little bit different, there may be more than one individual working with a provider. And so there is HIPAA, and then there is their version. So it's a little bit different, and I wonder if that doesn't bleed into some other areas. And so it's just a whole different context. So again, every time we go, we're learning, an opportunity to engage, but thank you so much for that question. And really, thank you, everyone. We look forward to continuing to go and grow and learn.
Thank you, everyone. Can I, sorry, this is Jesse. Can I just make one quick request before we all sign off? Can we do a group picture?
Do you need me to is it okay with what's on the screen? Is that you would like that there? In Barranquilla, me quedo?
We can unshare the.
Unshare that?
Yeah.
Unshare. Okay. 1 second. Stop presenting.
All right, and then Jamie is going to do a screenshot.
Okay.
Okay, guys, ready? 1, 2, 3. Awesome.
Amazing. Thank you, everyone.
Thank you.
Thank you.
Have a good night.
Thank
Bye,
you, guys.
Stephanie.
Bye,
Bye.
Jessie.
Thank you.
Thank
Bye.
you, Ivonne. Bye-bye.
Bye-bye.